Welcome to the LowCarbUSA podcast, where we seek to inspire you to help us build this community. I'm Doug Reynolds.
And this is Pam Devine. Hi, everybody. We're super excited to have a very special guest with us today, Dr. Kristin Baier. Welcome, Kristin.
Hi, thanks for having me.
We wanted to talk to Kristin today about her personal story, how she started low carb and then started implementing it with her patients. She is a family medicine doctor. She is recently board certified in obesity medicine, living and practicing in Chicago, and just in the process of moving out here close to us in San Diego, California soon. So welcome, Kristin. And let's get started just by talking about your personal story, how you got started in your transition maybe working with your patients.
Sure. So my journey began probably close to 10 years ago. I was in medical school at the time, and I had recently been diagnosed with lupus. And I was having a lot of vague symptoms, just bad fatigue, joint pains, skin issues. And I started focusing on nutrition as a means of modifying autoimmune disease at that time, because I didn't want to stay on medications and steroids for the rest of my life. The first book that I picked up was actually about going vegan for autoimmune symptoms. So I thought, okay, I'll give this a try. And I was vegan for about 5 years. And let's just say things did not improve. And I picked up a few more problems along the way, including anxiety, some depression, a iron deficiency, and a vitamin B12 deficiency. And I finally realized that that way of eating was not helping me at all. And someone had directed me to the work of Robb Wolf, who is big in the Paleo world and has the Paleo autoimmune protocol. So I read through his books and materials and decided I was going to transition from being vegan to Paleo. And I did. My symptoms improved dramatically, but I still was having some flares of autoimmune disease, and I was getting migraines that seemed to be coming more frequently at that point. But my B12 deficiency, iron deficiency, anxiety, depression, that all improved. But I was looking for a way of trying to stop my migraines, and I had never heard of the ketogenic diet or a low carb diet really up until that point. I had been pretty good about staying away from grains and added sugar, but I don't think I was ever truly in ketosis during my time in Paleo. But I had come across a book by Dr. Josh Turknett. It's called The Migraine Miracle. And that was my introduction to ketogenic diets, and with some other lifestyle modifications. He pretty much promoted a low carb ketogenic diet as a means of controlling migraines. So I was a little hesitant at first. As you know, traditional medicine really does not promote or train us to eat a lot of fat in the diet. It focuses a lot on grains and higher carbohydrate content. So I researched it enough to the point where I felt comfortable that I would not get heart disease or drop dead from eating so much fat, especially saturated fat. And within several weeks of changing my diet to very low carb, probably less than 20 grams a day, my migraines were gone, and I was able to wean off of quite a few medications. I think I was on 4 medications just for migraines at that point, trying to control them. In addition to medical Botox injections, where they inject 32 different spots around your head and neck to help prevent migraines, which none of it really did much for me, but the ketogenic diet did, and I weaned off my medication, and then I realized all my autoimmune symptoms were improving as well. And I was able to stop using prednisone on an as-needed basis, and slowly weaned off of Plaquenil as well. So, and the unexpected but welcome side effect was weight loss along with that. So that's kind of my journey as to how I discovered a low carb way of eating.
It's pretty incredible. Were you really surprised by the fact that you hadn't learned much of this while you were in medical school and you had suffered and started with these kind of symptoms while you were learning medicine?
Yes. I mean, really, it's a mix of emotions. At first, you're just so happy that something is working.
Yes.
I should say I went into it with very little expectations. It was just like, we'll give this a try. We've done everything else. And it was almost shocking how well it worked. I mean, it exceeded any expectation that I had by far and away. And then after that excitement wears off, you do get kind of angry and think, hey, I paid hundreds of thousands of dollars for this education, dedicated many years of my life, and I had never heard of this before, and it was never presented as a treatment option for me from specialists, and definitely nothing I learned in my own training. So that's my motivation now, to make sure other people and patients who have been suffering from these issues are presented at least with the option and know there are alternatives to try before resorting to a life on medication.
That gets both of us going. I mean, it just got my blood pressure going when I think about, we hear that over and over again from medical professionals, from individuals who don't have any medical training at all. And it just kind of cements the mission that Doug and I have gotten on for education and bringing awareness. It just really gets our goat when you hear time and time again on the news about a fad diet. And I put hashtag fat, not a fad diet on just a post yesterday, because it's doing such a disservice for people that can have healing and better quality of life. When people put a label of medical nutritional therapy, or just nutritional therapy, or just eating real whole foods and maybe taking some out to help their recovery and live a better quality of life. And Doug's ready to put something in there.
Yeah, no. So I mean, what I wanted to know is when, at what point did you decide to now think, okay, I need to take this to my patients? And what I want to kind of go into a little bit here is how you actually do that. When you hear about, because it's all very well saying, yeah, doctors should tell their patients that, but a lot of people, most people are not open to this conversation. So I'm interested to hear how you approach it and how you actually teach your patients to do this.
Right. So I would say I kept pretty quiet about it for maybe the first year. And some of it was to make sure that the results were sustainable and it wasn't something that would wear off in a few months. Make sure the diet itself was sustainable and not something that is going to be a headache or a hassle for patients to transition to for the rest of their lives, hopefully. And then I wanted to really dive into the research. And there's two sides you have to consider. One is the patient's reaction and how they're going to receive this information. And two, it's your peers and colleagues in the medical world. And that's who you really need to impress with the science and the research and the randomized controlled studies. So I wanted to make sure I was armed with that and have good, evidence as much as we can that there is a place for therapeutic nutritional ketosis as far as weight management, diabetes, even disease prevention at this point, especially for some of the neurological diseases, IBS and autoimmune disease, and it can play a role. So like I said, it took me about a year to feel comfortable enough, even talking about it or promoting it to anyone. In our current healthcare system, that's largely run by healthcare administrators with no clinical experience, no clinical background, and dictated by insurance, telling you to see more patients and what you're going to be reimbursed for. It's extremely hard to find time to educate patients on nutrition and lifestyle. So it takes a good hour at least on that first visit.
Yeah.
Currently, we have like, 15 minutes, and then another 15 to 20 minutes of documenting and an electronic medical record on top of that. So our system it's challenging. It is very challenging. You defer by sending them to dietitians who, the majority, not all of them, but the majority are practicing the guidelines that call for, follow the food pyramid, and 60 to 70% of the diet is carbohydrates. And that's definitely not going to help my patients when I'm talking to them about the opposite way of eating. So that kind of takes me to why I'm relocating to San Diego, because I was fortunate enough to meet Dr. Brian Lenskis at LowCarbUSA in Boca this past January. And he was in a similar position, kind of frustrated with the way his practice was being run and not having enough time. But yet he would work through his lunch breaks and into the evening, taking the hour to educate patients and having a lot of success getting patients off of their insulin, helping them lose weight, reversing diabetes. And we started talking, and many things had to align, but somehow they did. And we decided we're going to branch off on our own and start a direct primary care and metabolic health clinic in San Diego. So we have a platform that allows for us to spend adequate time with patients, and to coach them appropriately, and to really get to the root cause of the disease and intervene with nutrition and lifestyle before jumping to medication.
Yeah, so you mentioned that you were in Boca, and we had a vendor there called Restore Health. I don't know if you spent any time with them, but we were basically working with them. It wasn't ready to launch when we were there in Boca, but it's been launched a couple of weeks ago now. And one of the things that we saw that was missing in this picture, especially for the regular docs, is that they don't have the time to teach their patients how to do it. And so Restore Health recognized that there was possibly a gap there to provide some kind of certified training for people like you and other doctors to point their patients to, in order to say, okay, you get it. I'm telling you this is what you need to do, and you're accepting that. Here's a group of people, like for a very reasonable price, are going to be able to hold your hand, have personal coaches, and help you through that process. And so a lot of people need that. I was able to just read all the science and just pull the trigger and do it myself. But a lot of people are not able to do that. They need more hand-holding. So we've launched this program now where on the nutrition side, they teach all, and now we actually certify that whole program. So we've gone through every lesson and made sure that the information is correct. But it also ties in with an exercise program, which is kind of at its core is Dr. Ben's 15-minute workout, right? So you heard Dr. Ben in Boca talk.
Oh, yeah.
I think a lot of people listening here have probably heard him. They should look him up if they haven't. I'm just interested to hear your idea, because a lot of the time when we're talking about the ketogenic diet, it's more and more of it saying it's about what you eat. It's not about exercise. But that's for our regular concept of exercise in terms of cardio and running and cycling and all of that. And as Dr. Ben explains, in that case, that is true, that all you do is borrow from your fat stores and you pay it back later when you eat again. But his exercise concept is kind of unique, and it does activate the same metabolic pathways as the ketogenic diet does, and so it makes a really good adjunct. I don't know if you've had a chance to look into that at all, even try it, whether you have any ideas about what value that might bring to the table.
So I think there is undoubtedly a lot of benefit to exercise, and I think it's more important as people age to maintain muscle and muscle mass. I mean, it's important at every stage of life, but really when hormones change and as people age, it's more important, and it's harder to maintain and grow muscle. So I was definitely guilty of being a cardio addict, probably through my teenage years and into my 20s, and just running insane amounts, not because I enjoyed it, but because I was trying to burn off all the carbs I was eating. And as most people have a similar experience, it wasn't very effective. As the saying goes, you can't outrun a bad diet. And it was really after I started paying more attention to what I ate that I started to research a little bit more about different types of exercise and what type of muscle fibers are triggered. And of course, everyone is busy. Every adult is busy now, doesn't have time, maybe doesn't have access to equipment. And you want to be able to make exercise as efficient as possible. And running 2 hours a day is not efficient and not realistic for many people. So with that in mind, I do think there is a lot of benefit to some cardiovascular exercise, and it's more for mental health and to produce BDNF and everything else. Not great for weight loss, but I do think a good strength training program is ideal for people in every adult in every stage of adulthood. I love Dr. Ben's program because it's efficient, right? 15 minutes twice a week, but you work the muscle till failure and you deplete the glycogen stores. It's incredibly efficient, it's effective, and I think it does play a role. Is everyone ready to start that right at the beginning of their dietary changes? No. Some people are already active, but I think it's something to work towards and there is benefit. But I do think people get benefit from a ketogenic diet without exercising. So it's not a one size fits all. It's definitely something that should be tailored to individual needs and goals and where they are in their stage of life.
Yeah, for sure. I know Dr. Ben talks about, maybe there is someone who has back pain, who's been overweight for many years, who has knee problems, or they're in their 80s and they're not going to be able to, go right into doing biceps and squats and stuff. But he has a real knack of showing somebody a place to start. Just get up and down out of a chair, maybe something to failure and something way more active than they had been doing. Maybe someone's able to do a wall sit for just 30 seconds and, stop, adjusting some of the other exercises to an injury or an activity level, or, based on age or sickness or ability of what they've been doing. That actually brings me to talking about, like when you said activating muscle fibers and depleting glycogen stores, how it leads to more increasing insulin sensitivity and reducing insulin resistance.
Right. Yeah, that's a good question. So, and why that's important is because the more we're learning as far as cardiovascular disease and inflammation, insulin resistance or hyperinsulinemia is thought to be a root cause of a lot of diseases, and we're learning more and more about it. So we want to offset that by having insulin sensitivity, and that means our cells are receptive to insulin, and insulin is going to help shuttle glucose inside, so it's not staying in our bloodstream causing hyperglycemia, which eventually will lead to prediabetes and diabetes. So we have to find a place for this glucose to go, for insulin to take it into cells. I can't remember the exact amount, but if it's about a teaspoon of sugar equivalent in the bloodstream at all times, which is not much at all. So insulin's role is to shuttle glucose inside the cells, but it can be stored in the liver, in muscles, in fat. Ideally, we want to keep the glycogen stores in our muscle and keep it low enough that it's not, our glucose intake low enough that it's not being stored in fat cells. So the more you exercise those muscles, the more the glycogen is depleted and there's more space for glucose that you ingest, and insulin's role to shuttle it in. Now, if you just have a high carbohydrate diet, you're sedentary, you're not moving much, there isn't space for all this glucose to go. It's going to be stored in your fat cells, but you're also secreting insulin constantly. If you're eating all day long, eating high carbs, so eventually your body becomes sensitized to that high level of insulin, if that makes sense. So the best way to improve insulin sensitivity is to help exercise, help deplete those glycogen stores, so there's space for glucose to go. It's not going to require high amounts of insulin and try to keep everything kind of in this euglycemic level. Does that answer your question?
Oh, totally. And I think it's really important. I don't know the majority of our community and family members and population don't understand really what insulin resistance and insulin sensitivity is. And we've seen, just over the last couple of months with this time that we've gotten into with the pandemic, that metabolic health is really key to not having such dire side effects if you're going to get COVID-19 or the flu or any kind of illness itself, for immune health and not having this crazy response. So if we could talk a little bit about how do you think insulin resistance and blood sugar levels are influencing people's ability to fight off a virus, but also its response to, so that people can understand a little bit more.
Right. No, that's a great question and super important right now in the time of the coronavirus, COVID-19. But, and we've seen a lot of the risk for complications comes from patients with metabolic disease. And by metabolic disease, we mean elevated blood sugar, elevated blood pressure, increased waist circumference. And all of that is going to be attributable to insulin resistance or elevated insulin levels. And there is an impact. It's systemic. You can't isolate it and say it's only affecting one system of your body. It does have a negative impact on the immune system, and it's going to impair your body's ability to fight any infection. Similar to how any diabetic could tell you, if their sugar levels are not controlled, if they're constantly in the upper 200s, 300s, they get any infection. It's hard to fight off because bacteria love sugar, and that's how they're going to thrive. So controlling glucose levels and doing that through maintaining insulin sensitivity and watching your diet to make sure it's in accordance with eliminating a lot of the glycemic variability, you're going to reduce a lot of inflammation, you're going to improve your insulin sensitivity, and your immune system is going to be functioning at more optimal levels than it otherwise would.
Yeah, I think it's really important for people to understand for immune health, but also overall health and reducing inflammation and blood sugar levels and insulin's hyperinsulinemia, which I don't think a lot of people understand, even just those elevated insulin levels, what they're doing, like you said, on a systemic level. So you're really focusing and transitioning your practice with Dr. Brian Lenskes here into San Diego for, you're even calling it the metabolic health and San Diego. What is it? Metabolic health?
Low Carb MD San Diego Metabolic Health and Direct Primary Care. It's not a short name. So we wanted to get it all in.
So that actually brings me to that. So I don't believe you've actually built out a website yet for that, right? You guys?
It's under construction.
Under construction,
we have
right?
the content there. We need to pretty it up a little bit now.
Okay.
but
the point really, so you don't have a URL that you can point people to. But if they search for Low Carb MD San Diego.
Actually, they can go to our website is LowCarbMDSanDiego.com. And we are taking, please excuse the aesthetics at this point, but we are taking patient applications right now.
Okay,
and
cool.
People can sign up. We're hoping to launch by July 1st. Hopefully, fingers crossed, everything goes smoothly and we get off the ground. But yeah, we're definitely taking patient applications now.
Right, and you are going to be doing where you at least have the bandwidth to do some online consulting as well. So for people that are not listening to this that are not in San Diego, that would really love to consult with you or Dr. Brian, I believe on that website there will be a way for people to book remote consultations as well, right?
Exactly. Yeah, we're going to have the ability to do some telehealth consulting. We're also setting up where a good part of our practice can be virtual. We have to be in accordance with state laws and medical licensing and all of that. But one benefit of COVID right now is a lot of states have relaxed their laws. As long as you have a medical license in one state, you can practice in other states. So hopefully that turns into a permanent change. But we will have the ability to see patients that are not currently in San Diego, and that can be through a health coaching platform for like a one-time consult, kind of get a feel, or we can discuss options of bringing them on and into our metabolic health program and doing a remote visit. So it's a little different for every state right now, but yeah, we're absolutely trying to accommodate people outside of the San Diego area as well.
Yeah, that's cool. I mean, because and I know Brian's learning a lot from Dr. Tro, who's his partner on the LowCarbMD podcast, right? And Tro's got a really cool practice there where he does a lot of virtual consulting there, and he has a lot. They do a lot of remote monitoring and stuff as well, so that they have this equipment that feeds into their database and that, and it actually gives them red flags and alerts in real time if people's weight goes up or blood pressure goes up or whatever other metrics they're actually monitoring. And it enables them to even respond even quicker than if they were only able to see the patients live. So I think there's a lot of scope for where that whole remote monitoring concept is going to go in medicine over the next few years.
Yeah, we're very excited about it. And Dr. Tro has been instrumental in helping us get set up, and we're using similar platforms, and we'll have the same ability to remotely monitor and hopefully intervene earlier than otherwise, you know, patient waiting for an appointment and all that. But yes, Dr. Tro has been a huge help for us. His practice is incredible, and his staff, Talene and everyone there, they've really helped Brian and I a lot. And, you know, hopefully we can get this going and help other practitioners feel comfortable taking the leap and knowing there's a platform already designed, and it's just a matter of implementing it and getting set up.
Well, thank you. I mean, we are super excited to be next week already in welcoming you into our San Diego community formally and officially. And even to kick that off, we've had to suspend all our local San Diego meetings because of this whole COVID thing, and we've been threatening to do some kind of virtual event. And your coming here has actually prompted us or kicked our butts to actually make that happen. So we're going to do our first virtual San Diego event, which, even though it's kind of for our San Diego community, since it's streaming, we're going to put it out and anybody can watch it. They don't have to be in San Diego, right?
Yeah.
So you guys are going to you and Brian are going to do a presentation. I think it's on the 13th, right? Saturday the 13th of June.
Yep, that's correct.
Yeah, we'll put out the stuff on LowCarbUSA over the next 2 weeks or 3 weeks to tell everybody about that. But yeah, that might be your first official introduction to our community.
Oh, I'm very excited about it. I can't wait. And I've been messaging a few people on social media in the San Diego area. Everyone's been so welcoming and wonderful. I'm very excited to get involved in the community and hopefully do some lectures and kind of town hall events and virtual events and really help spread the message and, you know, just amplifying the great work you guys are doing at LowCarbUSA with your events. It's really a privilege to work with you guys and collaborate.
We're excited to continue that education alongside you and Dr. Lenska. And I know there's a lot of people who are really excited about having the ability to have a new doctor in a new practice. We encourage everybody to go to the website and learn about the programs, following Kristin. Dr. Kristin is Doctoring Keto on Instagram. And then is it also that on Twitter?
It is, yep. Doctoring Keto, both Instagram and Twitter. Maybe one day I'll join the TikTok movement and Facebook, but
you have to get your dance moves on.
Yeah, no one wants to see me dance. Yeah. So, yeah, I think Dr. Kristin Assad has TikTok mastered.
Yeah, no, he's got that button down, man. I tell you.
Yeah.
You can't compete. Once people see dim, it's like, okay, I'm not going there.
So there is a Facebook page for Low Carb MD San Diego. It might have the metabolic health part in the thing if people search for it. I know I'm supporting on that page already as it grows.
You.
So we want to make sure we continue educating people and connecting with Dr. Kristin Baier. Thanks so much for joining us and sharing your journey with other people today. And we're wishing you the best of luck. We're going to date this podcast, but it's always going to be recorded. We wish you the best travels next weekend with all of your belongings and moving in. And
Thank you. It's needed. Moving is quite the process.
It is,
but
and
worth it.
It's even more challenging during this time. And we're looking forward to having you here and when we can all get together in person again.
Yeah, that'll be great. Thank you so much for having me.
Thanks, Kristin.
Okay, thanks.
All right. Take care.
You've been listening to an episode of the LowCarbUSA podcast. You can support us on Patreon at patreon.com/LowCarbUSA.